Hello and welcome to the Monday Agenda. Today, the Monday Agenda visits CCBRT, and as we all know, CCBRT has been very instrumental in promoting health in Tanzania. And not only that, but we are very highly privileged to actually have this interview with the CEO of CCBRT, Miss Brenda Msangi. Tell us, how did how has your journey begun, you as a person, before we look on to CCBRT to becoming the CEO of such a huge institution?
My day. So, first of all, Austin, thank you very much. I know this is the first time CCBRT we're being featured on your TV show, so it's quite a privilege. So, thank you very much. Coming back to myself and my journey. Believe it or not, this year will be my 10th year at CCBRT. 10th year. So
Okay.
I joined CCBRT in 2009, September. And this is actually, CCBRT is my first employer in Tanzania.
Wow.
Previous to that, I was working in the UK.
Okay.
So
Similar project?
so
more or less?
my background is pharmacist, so I'm a pharmacist
Okay.
by training. But then I got an opportunity to be in management at a very early stage of my career. So I practiced and was also leading a team, and by then I was working in the largest community pharmacy in the UK,
Okay.
called Lloyd's Pharmacy.
Okay.
And then I joined the CCBRT. I joined by then, they were looking for a deputy director for community programs. And not long after that, I think it was about 5 months, I was then promoted to be the director of community programs of CCBRT. And I started climbing that career ladder, but I was holding senior management positions. And then there was a restructuring within the organization, so I became the director of the hospital, disability hospital.
Mm-hmm.
And then which was followed by another restructuring with the new strategy. So then I was the chief operating officer, or the COO, just before I was appointed to be the CEO
Wow.
last year, December.
And how does it feel?
It's really about having a good support system, because of course I cannot do it on my own. So I'm very fortunate to have a very supporting family, and my girls as well. They know that their mother has a very demanding job, so
Yeah.
they also do their part in supporting me and my husband. Yes.
I also learned that you do not have an office.
I don't.
What does that entail, not have, as a CEO, not having an office?
Okay, so my leadership style, and this is all part of the lean thinking that we have deployed at CCBRT as a business strategy. We go to the people as leaders. We go to our teams. They don't come to us, because you need to go where the action is happening. You need to go to the Gemba, as they say. So I have a small working space where I have a small table and a laptop, but I don't really have a fancy
CEO's office,
CEO
desk, and,
no, I don't,
Okay.
unfortunately. But the whole idea is to go where the people are and
Okay.
really learn, because I can tell you, you will learn so much when you go to them rather than they come to you.
Okay.
Yeah.
How
September.
old is CCBRT?
Actually, we're marking our 25th.
25th. So you
Yes.
joined CCBRT when it was 15 years old.
Absolutely, yes.
But at least you're old enough to know, how were the 15 years before you joined, and
Yes.
they're forward.
So CCBRT actually started in 1994,
Okay.
and when CCBRT started, it was more of a community-based program, and it was more of finding those who were blind and restoring their sight, basically, and mainly due to cataract, because we did not have our own hospital here in Sasani.
Okay.
So it is until 2000 where the government of Tanzania gave us this plot.
Okay.
And the hospital was built. So from 2001, the hospital became operational,
Mhm.
and our core services were and still are, in ophthalmology, orthopedics, reconstructive surgery, and maternal newborn.
Mhm.
Now, by then and still now, our mission at CCBRT is to really find and increase accessibility to those who are most vulnerable. and our core business is in disability and rehabilitation.
Okay.
So we are the leading providers of disability and rehabilitation services in Tanzania. What it is, our core business as CCBRT is eye. So we provide eye services. We deal with bones. We deal with repairing deformities, birth deformities. And then also we deal with mothers and newborn. So that is, let's say, in a layman's language.
Yes.
So our policy as CCBRT is that we're providing free services for children under 5.
Okay.
Who are also born with a congenital deformity, which is called cleft, which is a birth deformity.
Is it rabbit mouth?
Yeah, but then that's a discriminating way of putting it. Right. So, so basically we're providing those free services. But we know, Austin, there's nothing for free.
There ain't nothing for free.
And
even the air we breathe, they remind people we pay for the air we breathe.
Exactly, right? So we now, as an institution, as an organization, and that's part of the journey of CCBRT, we depend on development partners. So we depend on donor grants, even though ourselves we are generating revenue from the patients that we see. This is why, from the journey of 25 years, we also had to think of how are we going to reduce donor dependency, because these donors as well, it's not something that you can fully depend on, because it also depends on their climate, their economic climate.
Yeah.
And this is where the idea of becoming a social enterprise came about.
Okay.
How can we as CCBRT have a mechanism of increasing our own revenue, but at the same time not compromising quality and not compromising the accessibility for those who cannot afford.
Okay.
So, and this is where we are on our private clinic, and the idea is what we generate then goes and contribute to those who cannot afford to pay.
Okay. We're going to look onto the issues of sustainability, but first and foremost, let's look onto, before we go on to the eyes, which, if you speak of eyes problem in Tanzania, the first call is CCBRT. Let's look onto fistula.
Right.
Ever since CCBRT, I mean, I came to know about fistula through CCBRT. I did not know about fistula before.
Right.
And then I started my research, reading about it, and gaining my interest in it.
Yes.
And many people would also probably should also use this platform to know more about fistula. Actually, since you started interventions in was it 2001, specifically on when you started your operationalization here, how has the fistula been in terms of, are the numbers increasing, decreasing? Are we raising enough awareness?
When we started, actually, we only started with 40 cases a year.
40 cases a year.
A year.
Okay.
And we started growing gradually, but up to 2009, we were doing not more than 200 surgeries a year.
Wow.
But then WHO, they said, in developing countries, in sub-Saharan countries, the rate of new cases every year ranges between 2,000 and 3,000.
While you're doing 200.
While we were doing maximum of 200. So we said, hang on, something is not right here. And we needed to do something to see where are these women? Why are they not coming for treatment? So we did a survey, and a couple of things came as barriers why these women are not coming for treatment. First thing, it was awareness. So people didn't know what fistula is, and as you rightly said, people still don't know what fistula is. We're in 2019, but you can imagine back then, fistula was still associated with a lot of myths and misconceptions, to do with witchcraft, to do with all sorts of things. But also the cost of treatment. People could not afford to pay. Very expensive.
Very expensive.
The other barrier was the cost of transportation.
Yeah.
There are very few fistula centers in Tanzania. I mean, we are the leading in Tanzania, but we're not alone.
Okay.
So we have about 6 active fistula centers in Tanzania.
Okay.
Do
you know where they're located?
Of course we know where.
Okay.
And we're actually working together to see how we can get more women treated, because it's not a competition.
It's
At
not.
the end of the day, it's about ensuring that woman gets treated,
Receives the dignity,
Receive-
and
we
the
restore
things
that dignity.
really moved me as.
Absolutely.
Mhm.
And the other barrier was then, when they come, the hospital stay, because they will stay with us for about 3 weeks to up to 4 weeks. So you can imagine the cost of hospital stay and the cost of food when they come
They're
to the
admitted.
hospital.
Okay.
So these were kind of the major barriers that
Okay.
they were preventing these women to come. And this is where we say, okay, if we really want to make a difference, if we really want to change the lives of these women, we need to ensure that we are breaking all these barriers.
Okay.
And this is what we did. So we started our major campaign in 2012, and it was launched by Mama Salma Kikwete, who was the first lady by then. And this really made us going across Tanzania. We were going all the regions of Tanzania, all the districts of Tanzania. We were using all different media platforms. As a matter of fact, IPP and ITV, we have to really played a very major role in creating awareness across Tanzania. Does that mean we've reached all the villages of Tanzania? Absolutely not. We are not there yet. And this is why whenever we have that opportunity, we have to talk about fistula. And this is why I'm talking to you and to all Tanzanians what fistula is. And it's there, and we need to keep on talking about it. And for that note, I'm asking you, Austin, to also become an ambassador
I am.
on fistula. So how we work on now bringing these women, we use M-Pesa.
Okay.
We have planted ambassadors across Tanzania, and an ambassador is anyone really in that community who wants to make a difference in these the lives of these women. So they will call us. We provide training to these ambassadors, and they will call us when they come across a woman who is leaking urine or feces, because that's what fistula is.
Yeah.
And we have a call center here at Ccbrt'S dedicated only on fistula. They'll call us, they'll tell us we have come across a woman with fistula. We have a standard series of questions just to ensure that, okay, is it really fistula or is it something else? Once we confirm that, this is a fistula case, we then send money to the ambassador via M-Pesa.
Okay.
Because if we send money to this fistula patient, listen,
Not necessarily,
they have many other priorities.
Mm-hmm.
So we send the money to the ambassador. The ambassador then get the bus ticket, or if it's a train or whatever form of transportation, they need to ensure that this woman arrives here at Ccbrt'S.
Okay.
So they give us a call and they'll say, for example, the woman has got into this bus and it will arrive at a certain time, and then we go to Bungo to pick up the lady. And because these women have never even been outside their village, let alone come into a
and
big
with
city.
the myth, of course, may not even know that this problem can actually be treated.
They were also nervous. The community, they were not allowing these women to go outside.
Mingle and everything, yeah.
Because they're saying for free. For free? How is that even possible? So we were also associated with all sorts of all that. It's when they come, they get treated and they go back to the community. That also started building confidence in the community to say, okay, they went, they were leaking, they came back, they're treated. Now more women could go. So they themselves became ambassadors to really encourage other women to come. Okay. So apart from us being the leading provider of fistula services, we are also the only accredited fistula by FIGO to be trainers of other surgeons. So FIGO is a federation, international federation of gynes, and they bring us surgeons across the globe for us to train them on fistula.
Excellent.
2 weeks ago we had a team from Yemen.
Okay.
So we get them across, and we even in Tanzania we're also getting surgeons. And our whole idea is how can we build capacity, how can we build local capacity, and also beyond the boundaries of Tanzania,
Hmm.
so that people can also access treatment not only here at CCBRT, but
Absolutely.
in other
I mean,
facilities.
so what are the numbers today, after the campaigns, after your efforts? So how many cases do you attend in a year? Let's say 2018. How many cases do you have?
So 2018 at CCBRT, we were just under 550, so it was 549. But even for us internally, we were increasing, and we were doing 500. We were going to 600. The year before 2018, we did 650. So our aim this year is to reach 700 here at CCBRT.
Okay.
So that means we need to keep on talking about it. And then we need to ensure that we have enough resources to provide treatment when they come. So we're working with an organization called Viamo, and people will be able to get correct information about fistula, because we want to break those myths about fistula.
I was exposed also to Mabinti,
Yes.
the project. Is it still going on? Tell us more about it and how you empowered women who went back into their villages after they received treatment, I understand.
Ccbrt'S is not only a hospital, we also have development programs. So we have a program in Moshi, which is a CBR program. It's a rehabilitation program where we have we're doing rehabilitation services. We also have employability inclusive program, which is an advocacy unit. Not only we advocate, but also we try to find jobs for them. So we have a database of different skills, different people with disability with different skills, and employers can come to CCBRT so that we can provide that data. As you know, there's the policy, national policy, that if you have 20 employees or more, 3% of your employees should be people with disability. I mean, I'm very proud to say CCBRT, we are on 6%. So we've doubled. So we have a number of our colleagues who have different disabilities. Going back to Mabinti, which is also a development program that we have as at CCBRT, this is specific for women who receive treatment from fistula. So the idea is, once they get the treatment, if they reside in Dar es Salaam or they have relatives in Dar es Salaam, they join the Mabinti Center for 12 months. We give them different skills, and the whole idea, we want them, once they are done, they go back, they can have an entrepreneurial skill, that they can stand on their own and become economically empowered. Because remember, when these women come here, they are broken. Most of them, their husbands have left them. The community has really outcasted them. They cannot even go to churches and mosques. They cannot even join in social activity. They cannot participate in the community just because of their condition. So when they come here, they get the treatment, and then they enroll in Mabinti Center. We give them different skills to make handbags, to make Mabinti dolls, to make all sorts of, and also business skills. Basic business skills, so that they know how they can also operate their business. And then we give them a startup kit. So we give them a sewing machine and some other kind of capital investment, just to give them a startup to start their business. We are proud to say we're still here. We're actually expanding, so we'll have our first outlet at Slipway, and we're very proud of that. Where we can be selling our goods there. And the idea is, when they complete their studies, when we still follow up in their community. So we make sure that they're still there. They need support. We're there, because it's quite daunting. I mean, starting a business is not a small thing. So we don't leave them. We continue follow up on them. Even for the patients that we've treated here, we do 6 months check. How are you? Are you still dry? What are the challenges that you're facing? Are you integrated back in your community? And then we're so proud when we see that impact when they go back to their community.
So what has been the major cause of eye problems that, of the patients you mostly see at CCBRT?
Major causes include age,
Mm-hmm.
including trauma, congenital diseases, and also diabetic-related eye diseases. Those are kind of like the common trends.
And you have actually been attending all of them?
Yes.
Okay.
Yes, so we have cataract. I mean, cataract still remains to be our highest eye problem, and this is it can be removed to restore vision.
Absolutely.
And then of course glaucoma. So we always say if you reach the age of 45, make sure you start doing those routine checkups, because glaucoma is a silent eye killer. So what we usually say, we encourage people, make sure you do those checkups, because some of the things are very silent.
Yeah.
It's not that cataract, where you don't see and then you do surgery, you see. Some of the conditions you need to do regular checkups so that you catch them when they're still early, and then the interventions can be made.
How regular is regular? Is it, you do your checkup once every year, once every 3 months?
I'll say once every year. I mean,
Okay.
if you do that first checkup and then from that consultation, and then you'll be advised, if there are any signs of anything, then of course the specialist will also advise.
One of the predicaments that most Tanzanians have, or I would say most Africans have, is the fact that they would not go to a medical facility in fear of, what if I'm told, yes, I have a problem, and
Yes.
we have issues of hiking, medical prices, and all this, and diet restrictions. How do you, as CCBRT, address all these challenges?
We have to emphasize, prevention is very
Always.
much better than cure.
Absolutely.
Right? So, and these are the issues that I cannot emphasize enough, Austin, that prevention is better than cure. And I will really emphasize people to have that culture to come and do regular checkups. And I also have to say, CCBRT, we're the only eye center with an artificial, a prosthetic workshop. We're making artificial eyes, which are custom made. So we are getting patients across Tanzania, even across the borders of Tanzania, where we're making artificial eyes for those who have, for example, they had to remove their eyes maybe because of cancer, or eye injuries, or sometimes congenital deformities, and then we're making those eyes for cosmetic purposes, but it's also very important as reintegrating them back to the community. We tend to use any platform that we get, so this is one of the platforms that I am very proud of the work that we do, especially on artificial eyes.
How did you move from, fistula eyes into mother and child, which is again very demanding service?
We have a capacity building program where we're working with 23 facilities in Dar es Salaam. Why in Dar es Salaam? As a strategic urban center growing very fast, we had to ensure that we're working with these facilities to ensure that we are building capacity, and this is very tailor-made, and it's in terms of training, it's in terms of capacitating them on equipment and infrastructure to ensure that they are able to improve the quality of maternal care. And I'm proud to say since 2010 we've managed to reduce mortality rate by 40%.
40%?
40%.
Wow.
There's
is it at CCBRT or countrywide?
This is in Dar es Salaam.
In Dar es Salaam,
yeah,
okay.
So
in
with
Dar es Salaam.
In Dar es Salaam. So
okay.
we're working very, very closely with the regional medical health team in Dar es Salaam, and again working those 23 facilities, and we want to decongest them, to help them decongest them, improve the quality of the service they're providing, but also to ensure that we are strengthening the referral system, because that is crucial. And this is why we are also building our maternal hospital.
Yes.
Yes. So, and I'm glad to say we are resuming construction by the end of this month.
Okay.
And so hopefully by after the next 14 months, the construction will be done.
Okay.
And this will go hand in hand now with the phase one work that we've been working with the 23 facilities, so that we'll be having the right referrals coming to CCBRT, because our hospital, it's for high risk cases. So we have to make sure that the region also refers those high risk cases.
Is CCBRT a private institution, or is it a public institution in terms of ownership?
If you put in those two categories,
Yeah.
we'll categorize ourselves as private.
Private,
So
okay.
it's an NGO, and but we have a very special relationship with the government.
Okay.
And as a matter of fact, we will be signing a new MOU with the government. Anytime soon, I'm waiting to be called in to sign for that.
Okay.
So we'll have a PPP with the government. I mean, we work very closely with the government, with our mother ministry.
Is it too soon to talk about the PPP now, or we wait until it's signed and then you can tell us more about it? Okay, beautiful. No,
yes,
it's highly respected,
but regardless of that, I have to say we work very closely, and we have a very good relationship, because at the end of the day, we are contributing to the work, good work and efforts that the Ministry of Health.
But what are some of the key, challenges that you face as an institution? And before we look onto the sustainability and how you address some of these challenges, but what are some of the key, issues? And if you can focus on, the areas of interventions which, different audiences can be engaged to, leverage in some of them.
Financing is a challenge, and as I told you, we as CCBRT, the nature of the business, the core of our business, our mission is really looking into the most vulnerable and how we can provide access to those groups. Now, that means we need to really subsidize the services that we're providing. And again, I told you our policy of under fives is for free, and fistula as well is for free. We depend on development partners. We're depending on donors to subsidize the services. Currently, we're on 65, 35%.
Okay.
In that 65, we are depending on grants, and 35 is from our own revenue that we're generating.
Okay.
So the challenge with that is then, that is very, it can also be a risk. So how do we mitigate that risk to ensure that we are not heavily depending on the donors, because we will never be sustainable. We will always depend on partners, but how can we reduce that dependency?
At least, twist 65, 35 or something like that.
And this is where now the social enterprise came. Now, how can we increase our own revenue by providing a market of private patients or private services, so that what we receive from those private services goes and subsidized for those who cannot afford. You're the clientele for the private services, all the corporates, and so on and so forth. And we are going to officially launch our private clinic, which is an outpatient clinic. We've increased capacity by 300%. Full capacity will see about 15,000 patients a year. So we're very proud of this journey, because as you remember, 25 years, 1994 when we started as a CBR program, and now we're talking becoming a social enterprise. That for us is really something that we're very proud of as a journey. Challenge that comes with that as well, we're seeing the trend increasing from cash cash payments as revenue to insurance patient. So the challenge comes when 70% of our revenue is insured patients. So if the insurance companies are not paying on time, then you tend to
there's a gap there.
A gap of liquidity, because then something has to give in. You need to continue running your operations. So that is also the challenge that comes with insurance. So my plea is, the insurance companies, they really need to honor the remit on time, so that we can keep the engine going. But in other challenges that we're trying to address is to really, we have deployed lean as a business strategy, increasing efficiency and also improving quality of our services. And that's the whole mind shift and it's also a new culture, that we don't want improvement to be an event, improvement to be something that is continuously.
Absolutely.
Now, you cannot just have that culture just like that. You know, you need to have solid management systems in place.
Absolutely.
That will drive the behaviors and then will drive that culture at the end. And this is something that myself, I am really pushing and investing within CCBRT to build this new culture that will also help with the new strategy and ensure that we are increasing our efficiency and improving the quality of our services.
You have the enterprise as now your income generating services. Is it going to offer all services, or specifically on what what we refer to as the eyes,
social enterprise? It also offers other services that are outside our core business, and some of them it's a contractor that we partner with consultants who want to come. We provide a space, for example, and then we have a revenue share with them. So we have expanded our services. We have a physician in place, we have dentistry, we have pediatric, and so on and so forth. But remember, the whole aim of this social enterprise is to generate
income to sustain the rest of the
organization.
One word to our viewers.
Thank you very much to Tanzanians, because they have been major supporters of our work, and I cannot emphasize that support to continue. And now the fact that we have a social enterprise, we really welcome you to come and access our services. I welcome all those who can afford to come. Please do come, because know that when you come, you are contributing at a bigger cause. You're contributing for those who cannot afford to pay for services, and for us to be able to access more Tanzanians who cannot afford to pay for their services. So karibu sana to our new private clinic,
which will be launched.
End of the month
of March. Okay.
But we're open. So karibu sana. I'm sure you are passing by here, CCBRT. You are seeing this white fancy building. So pop in, and we'll be happy to provide you the services. And my commitment to you is we will continue to ensure that we're providing good quality services, and to say that continue to be our supporters, continue to be our ambassadors to the work that we're doing, especially our fistula work, because there's still women out there still do not know that they have this fistula and that it's treatable for free. So again, thank you very much, Austin. This has been awesome. And thank you for helping us telling our story to Tanzanians.
You're watching the Monday Agenda, and I was highly privileged to conduct this interview with Brenda Msangi, who is the CEO of CCBRT. Until next time, I'm your host, Austin Makani, and thank you for watching the Monday Agenda.